Hi, I'm Ron Miller. I'm a medical malpractice attorney with Miller & Zois. My law firm handles birth injury cases involving preeclampsia. Our law firm is based in Maryland, but we handle serious injury cases throughout the country. Preeclampsia is a disorder of pregnancy characterized by the onset of high blood pressure and sometimes a significant amount of protein in the urine. Preeclampsia is estimated to affect about 5% of deliveries, while eclampsia affects about 1.4% of all deliveries. The condition often begins about 20 weeks after a pregnancy. Most cases are diagnosed before delivery, but preeclampsia can also begin in the 6 weeks after delivery. Like most conditions, preeclampsia can range anywhere from mild to severe. About 1 in 200 cases of preeclampsia will progress to eclampsia, which occurs when the preeclamptic patient begins suffering seizures. It can't be stressed enough. Preeclampsia and eclampsia are life-threatening conditions for the mom and the child and need to be addressed immediately. Preeclampsia is thought to result from an abnormal placenta, the removal of which ends the disease in most cases. The placenta is the main life-sustaining connection between the mother and child. During a normal pregnancy, the placenta vascularizes with thousands of blood vessels to allow for the exchange of water, gases, and solutes, including like nutrients and waste, between maternal and fetal circulations. Abnormal development of the placenta blood vessels leads to poor placental perfusion. It is thought that this results in oxidative stress, hypoxia, and the release of factors that promote blood vessel wall dysfunction, and inflammation and other possible reactions. In response, the blood vessels constrict, reducing the supply of blood and oxygen to vital organs that it requires to survive. Known risk factors for preeclampsia include multiple gestations, such as a twin pregnancy, which is a preeclampsia case I'm handling now in Pennsylvania, diabetes, which is actually a case we settled earlier this year in a birth injury case, kidney disease, chronic high blood pressure, a family with a history of preeclampsia. Other risk factors include advanced maternal age, which is greater than 35, obesity plus any placental abnormalities, and thyroid disorders. It is thought that in some cases, preeclampsia might be partly related to genetic abnormalities related to how the cells that create the placenta are created. No one fully understands it though. Signs and symptoms of preeclampsia include swelling, especially in the hands and face, sudden weight gain, blurred vision, nausea, headache, lower back pain, shoulder pain, and upper abdominal pain. These are symptoms any healthcare provider should see and connect to preeclampsia if they're paying attention and the other symptoms line up. High blood pressure should be discovered during routine care examinations during the woman's pregnancy. Special urine test strips detect the presence of protein. These visits are usually done at each doctor's visit during pregnancy. Preeclampsia is diagnosed when a patient develops blood pressure greater than or equal to 140/90 on two separate readings taken at least 4 to 6 hours apart in an individual who previously had normal blood pressure. Protein in the urine greater than or equal to 300 milligrams or more in a 24-hour period is also thought to be an indication of preeclampsia. That said, suspicion of preeclampsia should be maintained in pregnancy complicated by elevated blood pressure alone, even in the absence of protein in the urine. Why? Because protein is not a great marker. Only 10% of individuals with signs and symptoms of preeclampsia and 20% of individuals with eclampsia showed no signs of protein in the urine. Therefore, it's incumbent upon the healthcare provider to carefully monitor a patient with new onset of high blood pressure for any evidence of additional abnormalities in the mom or the fetus. Sometimes the best way to deal with preeclampsia is to be safe and simply admit the mother to the hospital for continuous monitoring of her labs, physical condition, and the baby's fetal heart rate. In many cases, patients with preeclampsia take a turn for the worst very quickly, and a physician needs to respond immediately with what? A C-section. Ultimately, the only way to solve preeclampsia is deliver the baby in the placenta. I can't stress it enough. Preeclampsia is a life-threatening medical condition. It must be identified and treated quick. Medical malpractice occurs when physicians and nurses fail to monitor the signs for the symptoms of preeclampsia, and fail to treat the patient by admitting them for continuous observation and or expediting delivery via a C-section. Failure to treat preeclampsia can be devastating for the child and the family. Many of the kids suffering from preeclampsia have permanent and debilitating injuries. They can't walk, talk, eat, or care for themselves on a daily basis. There's so much at stake here. These babies require 24/7 medical care and support. At Miller and Zoyce, we've seen firsthand the devastating consequences of preeclampsia. We know, because we have seen it, how it can change a family's life forever. If you or your child have suffered from preeclampsia or eclampsia, call me. Again, my name is Ron Miller. You can call me at 800-553-8882. That's 800-553-8082. And we can talk about your options for pursuing a potential case. Thank you.